Tuesday continues here on One News Now. I'm Charles Lejano. President Rodrigo Duterte's vice presidential bid is not yet set in stone. That's despite his earlier pronouncements this week. Palace spokesperson Harry Roque explained that this could happen if Davao City Mayor Sara Duterte declares her candidacy for president in the 2022 elections.
Sinulat ko po yan as he was speaking. I quote, kung tatakbo si Mayor Sara, Bong will not run for president. If Sara runs, out na rin ako because of delikadesa. Hindi po pwedeng dalawa kami diyan.
However, this did not sit well with the Davao chief, and according to Inday Sara, her dad had confirmed with her that the God Duterte tandem was already in the works. That's why in a statement, the presidential daughter requested to stop being dragged into their narrative and to not let her be the basis of their political decisions. Pressure mounts for the Department of Health to immediately provide the benefits that they've been promising to health workers since last year. The agency is confident that they can distribute the special risk allowances within a week and a half, or ahead of President Duterte's deadline. Romel Lopez with the rest of the story.
Christy has been a public hospital nurse for 19 years. All those years, she has been working 16-hour shifts. Yet, the workload is not commensurate with her pay.
Siyempre nalulungkot ako para sa sarili ko. Bakit kailangan ko pang mangutang? Bakit kailangan ko rin itaya yung ganitong sistema?
Christy earns 39,000 pesos a month, but she only gets to take home 24,000 after deductions. To rub the salt to the wound, Christy has no special risk allowance.
Bakit hanggang ngayon, napakahirap para sa kanila na ibigay sa amin ang aming mga benepisyo na matagal na po namin talagang hinihingi sa kanila. Kung nagbigay man sila, very selective lang po.
Hers is not an isolated case. Hundreds of thousands face the same dilemma. That's why a healthcare workers group staged a protest over the lack of SRAs for medical frontliners. They also took a swipe of the health department for its unobligated funds at about 12 billion pesos, included in the 67 billion pesos deficiency the Commission on Audit had flagged. Those not in direct COVID care hopes to also receive SRAs just like midwife Joy.
Dapat ipamahagi para sa amin na nagtatrabaho dito, lagpas-lagpas sa 8 oras, 12 oras.
The Budget Department said it has already released 300 million pesos SRA that would benefit about 20,000 HCWs. This is from December 2020 up to June this year.
The SARO will be released today. It's already been released, I am told. So we will already download this to the regions and to the hospitals.
Recall that President Duterte gave 10 days to disperse the money to medical frontliners. On agenda, the Health Department has expressed confidence that it will beat Duterte's deadline.
So ito pong mga nabigay na requirements, pinoseso na po kahit wala pa yung pera para pagdating ng pondo, mailipat na ho namin yung pera.
Moving forward, the DOH seeks to expedite the next batch of SRAs for thousands of other frontliners. For News 5, Romel Lopez. We are One News.
The World Health Organization is challenging the Philippine government to improve both manpower and resources in our hospitals. At a press briefing of the WHO Western Pacific region, Dr. Takeshi Kasai emphasized the need to boost the country's healthcare system as cases rise due to the Delta variant. Kasai says it's a good thing that the Philippines increased bed capacity for COVID-19 cases back in April in anticipation of the current surge. But the WHO warns providing more support for hospitals and frontline health workers is still crucial.
But what is important is actually not just beds, but to make sure there is a doctor and nurses, and also there's sufficient equipment, and also the support to those working very hard.
The WHO also warns countries that the data on the benefits and safety of a COVID-19 booster shot remains inconclusive. Director General Tedros Ghebreyesus pointed out that it's a moral issue when some countries can afford to give boosters, while others have yet to even start their first round of inoculations. The WHO reiterates that most vulnerable people worldwide should be fully vaccinated first before high-income countries can deploy a top-up.
When some countries afford to have a booster and others are not even vaccinating the first and second round, it's a moral issue. And Mike had said it some time ago. It's like saying, okay, you have a life jacket and you're adding another one, while others don't have a single life jacket.
Meanwhile, WHO's chief scientist, Soumya Swaminathan, said there's also consensus among researchers and regulatory experts that the data needed for vaccine boosters was not conclusive.
It included regulatory experts from different regulatory agencies. There was consensus that there is no, that the data around the need for boosters is not conclusive.
The National Task Force Against COVID-19 is denying allegations. National Task Force Against COVID-19 is denying allegations You're still watching One News Now. I'm Charles Lejano. The National Task Force Against COVID-19 is denying allegations that they're delaying the signing of tripartite deals for COVID-19 vaccines. This comes after some lawmakers questioned the task force as to why they've not yet signed the multi-party agreements for the purchase of more COVID-19 shots. House Committee Chairman for Economic Affairs Sharon Garin said the pending vaccine deals could provide as much as 10 million more doses. In his defense, Vaccines Czar Carlito Galvez explained that some vaccine suppliers prefer to deal directly with the national government to avoid logistical issues.
Hindi po namin dinidelay. Ang ginagawa lang po namin is yung due diligence. Katulad po ng ginagawa ng DOH, ganun din po ang ginagawa po namin. Kaya po talagang gusto po namin na yung pera ng LGU at saka yung pera ng private sector, hindi po sila mapapahamak sa ginagawa po natin.
Should the LGU decide and allot their own money, and why not? No, why not? And it's not about competing with the national government. This is not a competition. If we have open resources, if we have resources from the local government in which national government doesn't have access, why not? We can place safeguards the money. We can place safeguards that it should not hinder the vaccination program.
Time now for a quick look at some of today's headlines. Senators grilled Health Secretary Francisco Duque once again, this time for billions worth of overstocked medicine. The Octa Research Group says COVID-19 transmission in Metro Manila has slowed down, but hospitals in the region are still overwhelmed with the number of patients. And Eric Matty's critically acclaimed film On the Job is getting a sequel. And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.